Hey guys, welcome back to Small Screen Shakedown. Today we'll talk about 4 life-changing surgeries on Dr. Pimple Popper. Let's head into it. Number 4, the man with the old newspaper cyst. Sure, this video is a doozy one. The dermatologist and host of TLC is tasked with removing an epidermoid cyst in it. Typically, the growths form after some kind of trauma occurs to the skin. Keratin begins to build up to create a lump. Typically, the cysts are benign and can range in size from just a few millimeters to the big pop that Dr. Lee just took on in her video. The clip starts with the dermatologist already having created an incision over the top of the growth. She then starts squeezing the sizable cyst with both hands, while her assistant dabs away blood to keep the area clean. The patient asks if she needs to push the hands of Dr. Lee as she places them on either side of the spot, but this one can be handled by the dermatologist. Dr. Lee starts squeezing steadily, and a deep grey ooze begins spilling out, promoting the doctor to tell her patient, "It's like you've got a wet newspaper underneath." This surgery definitely changed the patient's life for the better. Number 3, the old lady with the stubborn blackhead.
To worry about and just leave it alone.
Blackheads are basically anything but. They can pop up on anyone and everywhere. They are a real crowd pleaser every time dermatologist Sandra Lee MD, aka Dr. Pimple Popper, gets her hands on them. Usually a little bit of pressure from her handy come down extractor tool or a pinch of a few fingers does the trick. But some blackheads are extra stubborn. Dr. Pimple Popper deals with a very stubborn blackhead in this Instagram video. This blackhead was hidden on the ear of her patient, and it is abnormal. In her Instagram caption, Dr. Pimple Popper gives some strong advice. Always check behind your ears. You never know what's hiding behind there. Hashtag Dr. Pimple Popper. The video star offers a close-up view of the blackhead. Then Dr. Pimple Popper uses her calm down extractor tool to aim at the blackhead. She tries multiple angles and puts in her muscle, but the blackhead lingers on the ear. It is not 1 millimeter moving. Dr. Pimple Popper gives up on the extractor tool for calm downs and returns with a new technique. She has a scalpel in her hand and begins to pry on the blackhead. It essentially looks like she is stabbing at the ear of her patient, but she is the expert. Her technique of scalping works, and the blackhead releases in one big chunk. One fan compared the contents like cookie dough, which is a nice picture to take in the holidays. Popperholics in the comments are really satisfied. One wrote, "This is magnificent." Another one commented, "OMG, it's like a whole civilization behind the ear." But that civilization is officially extinct. Now thanks to Dr. Pimple Popper, really life-changing. Number 2, the woman with the medium-sized cyst in her face.
This thing is like your old friend.
Dr. Pimple Popper is tasked with popping up a sizable cyst right on the side of a patient's face in an Instagram video. The dermatologist and TLC host, whose real name is Dr. Sandra Lee, doesn't have any trouble popping this bump, and the contents just look like dough. Indeed, the growth in question is an epidermoid cyst. When dead skin gets trapped, these type of bumps form and don't slough off like it should. Rather, it builds up, resulting in a bump that is non-cancerous and typically painless. As with the cysts of Dr. Lee's patient, they typically develop it on the neck and face, but Dr. Lee is about to retrieve this. Dr. Lee starts the process by creating a small incision over the top of the cyst, which explains that she does not want to leave a big scar. Once the incision is done, she starts squeezing either side of the big bump, tumbling out as soon as she does. Dough-like white insides come, and Dr. Lee has to pull it away. Dr. Lee is able to carefully extract all the dead skin inside the cyst and manages to change the patient's life with this surgery. Number 1, the patient with the grapefruit-sized lipoma. Dr. Pimple Popper treated a patient in this surgery with a grapefruit-sized lipoma, or fat-filled growth that felt like a giant rubber ball stuck under the skin. These lipomas are usually painless. The patient said that they first noticed the growth 6 years ago, and since then it has continued to grow, which is common to lipomas. Dr. Pimple Popper, whose real name is Dr. Sandra Lee, adorned the growth to treat the patient, then sliced it through its center. Immediately after the lipoma open was cut, yellow fat-filled lumps appeared beneath the surface of the skin. Lee said that the nodules reminded her of the bubble wrap that was used to pack fragile items. Dr. Pimple Popper used scissors to cut off the top layer of nodules, then plunged her hand into this incision to massage more difficult to reach lumps and loosen them from the fibers of the underskin that held them up. She also used tweezers, for she couldn't grab small nodules with her fingers. The cavity at the upper back of the patient was lipoma-free after 40 minutes of cutting, pulling, and tweezing. Lee stitched the cavity to heal, showing the patient the dozens of lipoma bubbles that she had removed. "See, that was a pain in the butt," Lee commented after finishing the life-changing surgery. What do you think about these surgeries? Which was the most life-changing? Let us know in the comments section below. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so you don't miss out any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.